Hey guys, it's Dr. D. So in this episode of teleradiology and second medical opinion, we're going to talk about subtle femoral neck fractures, which are clinically very important. Usually in the ER, you see a lot of patients coming in with falls. Most of these patients are older, they have degenerative joint disease, and they're osteoporotic. All these factors making it more difficult to detect subtle fractures. So let's look at an interesting case that illustrates this point. So looking at this x-ray, if you look at the femoral neck, you do not see an obvious fracture, but you see a small calcification that is not typical. If you had an osteophyte or spur from a calcification, it usually does not occur here in the lateral aspect of the femoral neck. It usually occurs along the femoral head or acetabular region. Also, the lateral aspect of the femoral head is where most of these fractures are seen. So although you do not see an obvious break in the cortex, your index of suspicion should be very high at this point. So if I was in the ER at this point, because of this abnormality, I would order further imaging. A CAT scan or MRI. Usually a CAT scan because that's just going to be more convenient and faster done in the ER setting. So let's look at this CAT scan for the same patient. Here's the coronal CT scan. As you can see by the arrows, these are the fracture line. And actually you see multiple fracture lines, both laterally and medially. So as you see, any subtle abnormality or irregularity on the femoral neck should make you highly suspicious for a very occult or non-displaced femoral neck fracture. And the correct step then is to do a CT or MRI for further assessment, usually a CAT scan. Thank you for watching.